Long-term care is one of the really challenging issues in the United States today. The reality is that 70% of people over the age of 65 will need some form of long-term services and supports as they age, and on average, they're going to need that support for 3 years. There are roughly 12 million people that need some form of long-term services and supports. And what that means is help with things like bathing, dressing, eating and preparing meals. Commonly, people think that that's only provided in nursing homes, but the vast majority of folks who need that kind of help actually receive it in their homes and in their communities. When people aren't able to access the long-term services and supports that they need, they often have to back into receiving services some other way, often in ways that they don't particularly like and that aren't particularly effective or efficient. So, for example, while Medicare may pay for a little bit of rehabilitation care or a little bit of post-acute care while one is in the hospital, while one is discharged from a hospital, it doesn't cover the kind of broader long-term services and supports needs. And when people hit that point, what ends up happening is other problems crop up. They end up using the rest of the acute care delivery system to try to meet those needs. And you know, the emergency room, it's always there, the light is always on, it's always possible to admit somebody, and that's often not the right way to get care, the best source of care for somebody who really just needs a little bit of help at home. Now, the Americans face a stark reality because unless you happen to be fairly well off and healthy and can afford to buy long-term care insurance, or be poor enough, less than about $2,000 worth of personal resources to qualify for Medicaid, there's not much in that space right now to help people plan for their needs as they age. Medicare does not pay for these services. To this day, in polling that we and other foundations have done, people still really believe Medicare will be the source of support when the time comes, and that simply isn't so.